People come to us and they say, I want to make sure that I'm not going to get postpartum. Of course, what they mean specifically is postpartum depression. And they also may be thinking about postpartum anxiety or any of the other perinatal mood and anxiety disorders that can come up. So we need to know what's normal for our mental health after we've had a baby. You've just gone through a major life transition when you bring your newborn or multiples home. And so it is really natural for there to be an adjustment period where you don't feel quite like yourself. For a lot of people, what they experience is called baby blues, and it lasts for the first 2 weeks after bringing home a baby. It has to do with your hormones and with just the stress of it all, and it's normal to feel out of sorts. You might be weepy, you might be very tired or have trouble sleeping, you might feel moody and have huge mood swings that kind of go from one end of the pendulum to the other. You might be irritable. If all of that resolves during the first couple of weeks, then we consider it pretty common. And a lot of times just getting into a routine, getting some sleep, eating, and being cared for by the people around you while you take care of your baby is enough to get through what we call baby blues. But then there comes a point around week 2 or week 3 where we do expect you to be figuring out what your new normal is with a baby. If you haven't, then that's when what we call PMADs, perinatal mood and anxiety disorders, could be coming up. What I want to do in this video, since it's short and I am not a licensed mental health professional, is just give you some symptoms to watch out for. So really anything that's on any extreme is cause for concern. With sleep, if you can't sleep when the baby is sleeping and it's nighttime and you're tired but you have insomnia, that's a concern. Or on the other end of the spectrum, if you're always sleeping and you don't want to get out of bed and do simple activities like eating or taking a shower, and if you feel a lack of motivation overall, that's a pretty classic sign of depression, included in the postpartum depression variety. If you're feeling anxious, a little bit of concern about being a new mom and having a tiny baby is normal. But if you ever have thoughts that you can't get out of your head, worries about the baby's safety, the baby's health, if you feel like you're fixating or obsessing on something and it's like a loop that plays over and over, then that's cause for concern. If you feel irritable at your baby and it's causing you concern, that also can be a sign of anxiety or depression. 3 things. First, it's really important to know that this is common. As many as 1 in 5 new mothers, and we're not even including new fathers, might experience a mood disorder after having a baby. The second thing to know is that it does not make you a bad mother or a bad parent if you are experiencing trouble adjusting to having a new baby. It doesn't mean that someone is going to come and take your baby away. It doesn't mean that your baby would be better without you. And if you're ever having thoughts like that, then please talk to someone you trust. You're welcome to reach out to us. And if what you need is a therapist or a counselor, we absolutely can help you get to one. We have a few referrals. And that brings me to the third thing that you should know, which is that this can be really temporary. Whatever you're experiencing, whether it's anxiety, depression, OCD, anything that's coming up for you as you're adjusting to having a new baby, it can be treated. Sometimes what you need is to get more sleep and to be involved with people who are supportive, like a mom's group or a support group or a therapist. Sometimes you need medication. Sometimes you need to change some things about your lifestyle. There's a lot of different ways to treat it. but it is treatable and it can be temporary. Your experience with your new baby and your experience of motherhood and parenthood can absolutely get better. So don't think that because the first little while is hard, that that's just how it has to be. If you have questions, then please email us at info@dcmetromaternity. Reach out in the comments, visit our blog. Just know that you don't have to experience postpartum mood and anxiety disorders by yourself. There is absolutely help. And no matter where you're watching this from, a really good resource is Postpartum Support International. You're already on YouTube, so just head on over to the Googles and type in Postpartum Support International and find out where the closest meeting is or where the closest warm line is to you. Again, this can get better. This feeling can be temporary. And the fact that you're looking for resources or thinking about this ahead of time tells me that you're already a really good parent.